of our TMC 2020 Matrix Review webinar. Many of you are unable to access the links. I've been having problems with my original webinar server, so I'm going to go ahead and send it out to you as a shortened video, which I'm sure everyone would appreciate since the original one had some waiting times as the recording started before the actual presentation, and there was a lot of commentary questions, that sort of thing. And this is a lot more abridged of a version. So let me get right into it. I'm going to start, and this is the TMC 2020 Matrix Review. If you have not seen the CSE Matrix Review, that is really interesting with how significant the changes are on that one. I would highly recommend you look for that one if in your email, if you received this via email, and if you did not, please shoot me an email at Melissa, MELISSA, Allen, ALLEN, at examfacts.net, and I will be sure to send you, just ask for whatever you're looking for. All right, so here we are with the conditions added. So a lot of these have been kind of on the TMC, but they're very specific. What I have learned is if they actually spell it out for us, we should pay attention to it. So here we have interstitial lung disease, kind of one of these diseases from the past making a comeback. I'm old enough to remember pulmonary fibrosis back in the old days. The drug overdose has pretty much always kind of been on the TMC, but it's definitely in the matrix, so we should pay attention. TBI, sepsis, and lung cancer, and removed was pulmonary hypertension. There seems to be slightly less emphasis on nitric oxide in both the TMC and the CSE. All right, so if you have the matrix that you've downloaded from the MBRC website and are following along, the way this works is each of these single word slides is one of the main sections of the exam. After that, each slide is a subsection, and there is some additional information I will go over with you when we get to this first slide. So, evaluating data in the record. Here added was medication reconciliation and vascular lines. Now let's talk about those numbers on the bottom. The nice thing about the TMC matrix, which is not the case at all in the CSE matrix, is it actually tells you how many questions on each one. Well, the CSE matrix does tell you that. It just doesn't tell you how much they're worth, because the longer ones are worth so much more than the shorter ones. So, as far as the numbers, recall, application, and analysis are the three types of questions, as I'm sure you're all familiar with on the TMC. The number that is not parenthesized is the number of that type of question on the 2020 exam. The number in parentheses is the amount of that type of question on the 2015 exam. So here you can see recall increased in the section evaluating data in the record. And application did as well. And analysis, there are no analysis questions in this particular section. So that's the way the numbers work. I will not always bring attention to them unless they're really interesting. In performing clinical assessment, Mal-and-Potty, skin integrity, and cardiac catheterization was removed. So skin integrity goes along with a theme I've noticed, and that theme is prevention, do no harm. Skin integrity, it kind of goes along with our weaning, ventilator liberation. It was changed from weaning, right? We're really trying to get patients off the invasive and make sure we're not harming them in our hospital stay in any way. X-ray changes, lung inflation is definitely on there. So everyone needs to be able to evaluate a film. Now, we do not know if there are going to be films on the TMC. However, they have been on the CSE for a while. Pulmonary artery size is also on there, and then those are the numbers on the bottom. So analysis actually went way down on this one. Notice it used to be 4, and now there's only 1. Okay, performing procedures to gather clinical information. Added was mechanics of spontaneous ventilation, and then they mentioned minute volume, tidal volume, vital capacity. Spontaneous is what was added. Of course, all of these factors were always on the exam. So we just the trend seems to be a focus on spontaneous breathing, and I'm thinking we're going to see a lot less VC on the TMC. OI was also added, as was apnea brain death test. In addition, laryngeal cuff management. It's no longer just volume or pressure cuff. We're talking about the newer ET tubes with the laryngeal cuff. Okay, evaluating procedure results. Added was our apnea brain death test. And here again, most of the numbers went down. Application went up slightly, but analysis went down. All right, so recommending diagnostic procedures. Here, coags and cardiac biomarkers were added, and all skin tests were removed from both the TMC and the CSE. Okay, next section, troubleshooting, quality control, and infection control. There's some adjectives I left out there for brevity. So under assembling and troubleshooting equipment, heated high-flow nasal cannula and AED are now on both TMC and CSE. Ensuring infection control, donning and doffing of PPE is the only change that was added. Performing quality control procedures, there were no changes. However, this is an area that went up. If you look at that application, there's 3 more questions, recalls 1 more question, and analysis. There are now 3 questions where there used to be none. So what we did when we created our TMC preparation program is you can't cover every single thing in the matrix extremely thoroughly. What we try to cover is try to emphasize is the areas that have a huge emphasis on the test, and that's what I really like to use those numbers for. So if you're finding that you're having an area that students aren't getting, or that you just don't have time to cover in the classroom, look and see how much it's worth. And you may have to move things around if it's scored very highly, or there's other areas where they hardly put any questions on there, so it may not hurt you that much if you're unable to squeeze it in. Okay, initiation and modification of interventions. Here, maintaining patent airway, only thing was changed was video laryngoscopy. And in these sections, there were no changes in as far as additions or removing sections. There's just, and for the most part, there weren't significant changes in the numbers, with the exception of supporting oxygenation and ventilation. This went up. We have up by 3 in application and up by 3 in analysis. Okay, ensuring modifications are made to the respiratory care plan. Here, recommending a consultation of a physician specialist. This is also on the CSE, guys. So they're going to need to know how to evaluate those labs, evaluate that echo, whatever it might be, and know when they need to call in a cardiologist or a pulmonologist or neurosurge, endocrine, something like that. As far as pharmacological interventions, narcotic and benzodiazepine antagonists are added. All vaccines were removed to modifications on the respiratory care plan. However, of course, they're still in our prevention for our chronic disease. And if we want to, and there's a big emphasis on prevention and chronic disease. And if you watch my CSE webinar or video that goes over the CSE matrix, you'll see that we are really getting into managing chronic airway disease, especially things like COPD, and that's going to include the annual flu vaccines, and I think every 3 years the pneumonia vaccine, whatever that is. I can't remember exactly the frequency. All right, so in evidence-based medicine principles, GOLD is back. So the GOLD guidelines, and this goes along with our super emphasis on COPD. The CSE for sure is jumping up on COPD as far as questions. I would kind of bet, since these exams always kind of hold hands, as far as what's on one tends to be on the other, with of course more details and a little bit differently of course on the SIMS. But I would bet that there's a lot more COPD on the TMC as well. And there's always been a lot, right? Okay, so providing respiratory care in high-risk situations. Added is interprofessional communication. So here we're talking about patient protection, again, making sure the communication between ancillary and other disciplines is done well so that there's not any risk to the patient. Okay, in assisting a physician provider in performing procedures, we have our endobronchial ultrasound and our navigational bronchoscopy was added. All right, conducting patient and family education here, cystic fibrosis, tracheostomy care, and ventilator dependent patients were added, and this is also added in the CSE. Now, this is one of those situations where, yeah, that seems like a lot of stuff they're talking about education on, especially like tracheostomy care, depending on when your students, what exposure they have. They may not have that information. However, if you look at the numbers of questions, there's only 3 total questions in the whole section, not just these little subsections. The whole section only has 3 questions. So it's probably not the end of the world if you don't cover it very thoroughly here, although on the CSE, I think it's definitely going to be much more of an issue. All right, let's look at these total numbers. Everyone always says when there's a new TMC that, oh, it's going to be a lot more analysis and a lot more application. Here, actually, recall actually went up. Those memorizing the facts kind of things actually went up. Application did go up as well, by 5, but analysis dropped by 7. So it's very interesting that a lot of those things that people assume are not necessarily true. All right, I want to talk about a little bit about some straight up MBR statistics. And of course, these are raw numbers. They don't take into consideration the facts that students take these exams multiple times, and some people are coming in from previous years and that sort of things. But if we look at the raw numbers based on these MBRC statistics, there's a 43% pass rate on the TMC and then a 53% on the CSE. And that's really only because the CSE is those students that have already passed the TMC. So it's a little troubling with the fact that this year there's going to be that limit in place where they can only take each exam 3 times before having to wait 120 days. I would like to talk a little bit about our program. We are ExamFax. We have a totally new modern TMC preparation program. It is very, very in-depth, comprehensive. This program was made for students that have been out of school for a while, were never the top students, were kind of just hanging in there, if you will. And we have had tremendous luck. We had a student raise their score by 60. And then we routinely have students go up, because almost all of the people that have gone through our program have taken and failed the TMC prior. And that's kind of our niche, if you will. So if you are worried about your students, you're worried about them not passing, we would be an ideal program for you. And even if you're one of those schools that has great numbers, keep us in mind in case you have one of those students that drops out for health reasons, any number of reasons, and then comes back and it's been so long since they've had the material. Our TMC program is almost like respiratory school in 30 days. It's a 30-day program, and we have like an intense review of all the basics. Then we have a proprietary disease management lessons that really teach the students how to analyze the diseases and know what to apply and what to put the patients on based on their disease process and what's going on with the patients. It really enables them to critical think and approach the TMC questions with, actual fact and knowledge and thinking rather than guesswork. So if you would like any information about our program, we also have an amazing CSE program where we just might have found the magic bullet of actually how to get these decision-making scores way, way up. I'd be happy to talk to you about either of them. If you just want to shoot me an email, we could set up a time with no pressure whatsoever. I just love talking about these programs because they're so exciting. And I thought everyone would appreciate the information that I found while I was doing the research for the program. And we have people across the country that were doing research for the program, and we found it so interesting when we were working on this new matrix, some of the changes and some of the themes that are going on. All right, I wanted to keep this under 15 minutes. I think I've just about got it there, so I am going to go ahead and stop. Thank you so much. Again, if you would like to reach out, it's Melissa Allen at examfax.net, MELISSAALEN. Thank you so much.